So I would love to take a moment here and introduce our moderator for this discussion. Thank you so much, Kathy Meyer, for guiding us on this discussion. Kathy specializes in therapeutic placements for teens and young adults. As a mom of 3 adults and a mental health professional, she offers parents genuine and compassionate support as they navigate the process of getting help for their child. She is involved in many community nonprofits, including Connect. She consults with the local school system on mental health issues. She facilitates teen groups and teaches workshops in the local schools. We are so grateful to have her here and serving on the board of Connect Summit County. Take it away, Kathy.
Well, this is it. This is our final meeting of the minds, and it's a big topic. But first, I want to talk about our mission at Connect, which really is related to what we're going to talk about today. Our mission is to create a well-informed, stigma-free community with access to mental health for everybody. And in order to do this, we must talk about places where we enhance our mental health that aren't just in an office with a therapist, but in our community and different places that impact our citizens. We are aware that there are many barriers to treating mental health, and these issues stem from larger inequities in our community, in our nation, in our world. Our goal in this discussion is to talk openly, to talk honestly about these issues, and also offer ideas to build partnerships and advocate for change from the ground up. To do this, I really want to thank our donors who've made this possible. The Marriott Daughters, Katz Amsterdam Foundation, Park City Community Foundation, and so many individuals that give to Connect, both monetarily and volunteering. Betty, is there any other Facebook etiquette or Zoom etiquette that you want to go over?
Yeah, I would just love to invite people to please be as engaged as you would like to be. You can ask questions in the chat. You can share initiatives and ideas, right? Kathy really wants to reiterate, like, we're just a group of people having a conversation. We don't have all the answers. And so we would love for the public to be involved. A reminder, if you just joined, it's being recorded and streamed to Facebook Live. Remain muted, please. If you unmute, we will be able to see you. And we really don't want to record anyone who has not given authorization for us to do so. As an enhanced security, if you'd like to, you can take your camera down as well. So that's all I have, Kathy. Thank you so much.
Thank you. I'm going to introduce our panelists. The first is Sister Veronica. She is a Sister of the Holy Cross and a bilingual, bicultural counselor. We're so lucky she's in Park City. She's worked with survivors of trauma, diverse families, and with nonviolent parenting and support groups. Prior to being a counselor, she was an educator working closely with children with exceptional needs. She has ministered throughout the United States and in Ghana, and now is here. Thank you for being with us, Sister Veronica.
Thank you.
Our next panelist is Sheri Whitwer. Sheri is a longtime mental health and community advocate. She's worked in the community, in many nonprofits, in government, and in the corporate arenas. Sheri has a master's degree in public administration from the University of Utah, and she also serves on many boards. She's the board president for CIT, which we'll learn more about. It's a crisis intervention team that works with law enforcement and mental health. She's the board vice chair of Utah Housing Coalition, which I'm excited to hear about, and is the founder and board member of Peers Empowering Peers, which is a wonderful grassroots organization. Another panelist we have today is Allison. Allison joined Utah Health Policy Project in October of 2018 as a health access assister, which is a mouthful. I'm sure it's a hard job too. She has been community-minded since her youth. Her passion lies in assisting people in gaining access to healthcare and mental health care. This passion was solidified while studying international studies with an emphasis on global health and a double minor in Spanish and nutrition, also at the University of Utah. Go Utes. Our third panelist is Nelson Clayton. He's a professional counselor as well as a program manager with the University of Utah Health Plans. He has a master's degree in both counseling, psychology, and business administration. Currently, he manages the Medicaid behavioral health programs in Summit County and administers block grant funding to best meet community needs as directed by Summit County Behavioral Health Committee. Nelson's focus is on early intervention and treatment. He currently manages the school-based therapy programs in Summit County schools. And I'm excited to hear about those. Many years ago, I worked for Valley Mental Health in one of the school-based programs, so I'm a bit familiar. Thanks for being here. And last but not least, Jackie Ray Buckman. Jackie is from Park City, and we're so excited to have her here. She's battled a number of concerns when she was growing up with mental health, ranging from depression, anxiety, and substance abuse. She's a recent graduate of the University of Utah with a bachelor's of social work, my degree, love that, and now is employed as a housing case manager through Volunteers of America. She's managing the Youth Rapid Rehousing Program, where the goal is to quickly transition from homelessness to independent and stable living. We're really grateful to have you here as a Park City home and grown. Great. I want to say, just mirror what Betty said. This is a huge subject, and we've tried to break it down. I want to stress that we're having a discussion, we're looking for solutions, we're learning, but we're not all experts. We really want to invite the audience to chime in with questions, ideas, and any resources that we might not know about. So with that, we're going to get started. So before we can have an honest conversation about inequity and barriers in mental health delivery, we have to address how lack of access to basic needs affects everything. Yesterday, somebody said it well. You have to have boots to pull yourself up by your bootstraps. And it really resonated. Sheri, we're going to start with you. As somebody who has worked with diverse populations around our state, what can you add about these barriers with basic needs?
Yeah, so thank you. I'm thrilled to be here today and to be able to join in this discussion. I have worked from a variety of perspectives within the mental health system. Always, I have been an advocate, and I am a family member of someone who's affected by mental illness. I have, through the years, heard from many individuals living with mental illness and their families about the needs that they have. And I have really tried to maintain that communication. I think I just wanted to make that point, that the only way we can find out if what we have as far as the system, the programs and services are, is by listening to people with lived experience, people who are using the services. And too often I hear from people, you're spending all this money in for this service, but I would never use it. I don't feel safe using that. And so one thing we need to do, and keeping in mind diverse populations with diverse backgrounds, to constantly be checking in with the people we are trying to serve and intend to do well by, but making sure that we get good information and have them at the table in the decision-making process. To that end, so often when we talk about mental illness and mental health, we are looking at it from a very medical model, from a very therapeutic perspective. And too often with commercial health plans in particular, you have traditional outpatient therapy and medication management services, and then you have inpatient services. There's not a lot in between. With Medicaid, there's more. and more specialty programs that have been developed as well, such as case management, assertive community treatment teams, in which a multidisciplinary team made up of therapists and case managers, peers, voc rehab, psychiatrists, go to the client to provide services in the community, wherever that person is. So we're getting away from, or we need to get away more so from the, you've got a 10 o'clock meeting downtown, hope you make it there. We need to realize that in the throes of mental illness, people are often disorganized and have a lot of barriers, whether it's transportation or access to medications, access to treatment at all. And a good part of that is a good part of the problem with that is we start at treatment versus what do you need to live your life? And it's very difficult to have someone engage in treatment if their basic needs for living are not being met, if they don't have a safe, affordable, decent place to live, if they don't have access to food, if they don't have access to just environmental safety, where they feel like they can even focus on their mental health. Focusing on your mental health when you're in crisis is kind of a luxury, right? We're all trying to survive. I think we've all gotten a taste of that through the pandemic. We're just trying to get through the day. And it's very difficult to be focusing on any higher need. And so that's something I've become a real advocate for, is working on the social determinants of health, which include housing. If someone does not have housing and they go straight from a hospital back to living on the street, they will continue to cycle through the system. Too often we blame the person for that, but really, if they don't have a place to live or intensive services that serve them, then it's really more of a system failure on our part. And I think we need to acknowledge that we need to be helping people to live their lives, whatever that looks like.
Such important information. I mean, what comes first, does the mental health issue come first, or does the lack of support and services contribute to the mental health issue? I mean, and I think we really have to understand that process. Thank you. Like to move to Nelson, who is really embedded in our community here in Summit County. So often we look at Park City as such a privileged place. We can, our biggest issues are traffic and trails, but we have some real need in Summit County that goes beyond that I'd like to address today. And Nelson, what are you seeing in your role?
Well, I want to just say thank you, Sheri, for all that you were talking about. As I was preparing to speak on this panel, I thought a lot about the pandemic as well as the financial crisis that happened 12 years ago. So I've been lucky enough to live through two kind of catastrophic situations. And in the first, I felt very tenuous in my ability to keep paying the rent and hold on to my house that I had just purchased. And thinking back through that time, my daughter was pretty young, and was I going to be able to provide for everyone around me? And it was a very hard time. And I don't think it's very hard for people to imagine if you're facing foreclosure or lack of housing or lack of ability to take care of your family. What does that do to your higher level executive functioning? What does that do to your mental health? And during the pandemic, I think we really saw a tale of a few pandemics. I've been very fortunate in that for the most part, my job has remained remote at my house. I haven't had to expose myself or my loved ones to being sick. But a lot of the families that I work with, people had to work the entire time, and they were working in service industries where people were face to face. So one of the things that I remember is during those first days, before people were even wearing masks, I remember being in the checkout line. And I remember thinking about the person that was checking me out at the supermarket. and how she had to be face to face with, 50 people an hour for an 8-hour shift. And I just thought that, how do you even do that job? And let alone with people who were treating you poorly. So I really feel grateful for the things that I've been afforded in my life. And I feel like I'm not that far removed from feeling very tenuous in my life as well. And another thing that I thought about, and I'm sorry, I'm going kind of circuitous here. Another thing that I wanted to just acknowledge at the beginning is, I feel like me participating in this panel is not, I don't feel like it's the best thing. I would much rather hear the voice of someone who was diverse. My first thought was, you didn't have a middle-aged white guy, enough representation of middle-aged white guys on this panel. And I do think that there is a societal failure, especially in mental health, in representation of diverse communities. And I primarily work with Medicaid. And the community that I serve is much more diverse than the workforce that serves them. And that leads to worse treatment. And it's a societal failure. And I believe that societal failures are choices that people make and that societies make. And I would like for people who pay attention to these to hold their leaders to account for those choices that lead to inequality and to lack of access to care. So that's my soapbox. So I appreciate you all for listening to that, but I think it's really important. And throughout the time that I've been in Summit County, which is the last 3 years, I've just seen the stress that is placed on people day to day. It adds up, and it adds up in cardiovascular disease, but it also adds up in intergenerational poverty. It adds up in your ability to parent. If you have to work 2 jobs, your ability to be there after school for your children is lessened. Your ability to have patience with your children is lessened. Your ability to have patience with your main relationship is lessened. And so, housing costs, it affects that. And I also think that there's things that we could do. There's probably things that I could do that I try to look at in how easy is it to access these things? Because I actually think that we have amazing services open to everyone in Summit County, but sometimes they're very hard to access. And sometimes the way that you pay for access is you go through 4 hours of paperwork. Now, if you have to do 4 hours of paperwork to get a service, is it free? I would argue that it's not. To reduce the burden of getting access to things that are supposedly free, we can make the system work more quickly. And that's another thing that I think that, myself and leaders. So those are some of the thoughts that I have, but overall, inequality leads to kind of chronic stress and chronically being behind. And it's like having a bank account that gets overdrafts. And then the overdraft fee is another $35 that you're behind on your next paycheck, and then you're more likely to bounce the next check. And so that's kind of how I think about it. And that's what I would like us to see, like all of us to do a better job of addressing.
I really appreciate your comments. And I had a very similar feeling about being a middle-aged white woman having this conversation. And, that's why I really, we have somebody who is young, who I think it's really valuable to hear what's happening with young people. And we're going to hear also from Sister Veronica about what she's seeing from her clients in her programming. But your point is well taken. So Jackie, I'm really curious. I love that you're a case manager and you're probably seeing a lot of barriers for a specific population, young people. Can you talk to us a little bit about that?
Yeah, absolutely. Working in homeless services and specifically with youth who are experiencing homelessness, that's a very acute view that I've been able to take on of lack of access to basic needs. not having access to stable, secure housing is one of the most glaring examples you could come up with, I think, if you're having a conversation about not having your basic needs met, whether or not you're going to be able to get a bed at any of the shelters tonight, whether or not, if you don't get a bed, you're going to be able to find a tent or something to kind of shelter you from the elements, keep you warm if it's snowing or raining outside. These are all things that our youth are having to think about, and it's taking up the mental capacity that they have, and they don't have the resources or access to think about mental health concerns. If you're in that survival mode, all of your energy is focused on making it to the next day. So it's definitely something I've witnessed a lot of our clients struggling with, even in transitioning them into housing, which I am really fortunate to be a part of, and helping develop that program is wonderful. But you also see the struggles that they have with that transition. It's a huge adjustment to go from that survival mode into this new environment where, yes, there's a roof over your head, you have access to a shower whenever you want to use it, but you don't always have the skills to upkeep and maintain that. Specifically, like cleaning, you don't always know how to do tasks that maybe people in the general population don't even think about having to learn how to do. And then spending that mental energy on trying to assimilate yourself into the general populace in that way is draining, and it takes a lot of work. And even at that standpoint, mental health is still kind of a back burner concern. So there's a lot of different points at which these youth and people experiencing homelessness in general need support before we can start tackling the mental health issues, which are pervasive across the community and obviously need to be addressed. So it's a huge thing. It's a huge thing, the lack of basic needs.
Really helpful. Thank you so much. And I want to have Sister Veronica chime in here too. Just you're working with a population at Holy Cross Ministries, and I'd love to hear your take and feelings about barriers.
Yes, I agree with a lot of what others have shared, especially in the Latinx community, which is the community that I work with primarily. But one of the things that definitely affects them, like you were saying, Sheri, the housing piece, families. I mean, the first time I came here to volunteer, when I was volunteering here in Park City, was like in 2005. And there were a lot more families that could afford to live here in Park City. And so a lot of families, what they're experiencing in the Latinx community is that they work for the Park City community and Summit County, but they cannot afford to live here anymore because it's just has become so difficult. And one of the latest things that some of my clients have shared is that in the past, they were able to have an annual contract or a lease that they were able to renew. And now there are no more contracts in many of the housing apartments where they live. So they have a lot less security. And many of them, they can be asked to leave at any point. Another thing I think that's been difficult in the Latinx community is, we just don't have the boots. Like you were saying, it's good to be able to have opportunities to know options, but sometimes you don't really have a lot of options. And mental health too is something that comes to the back burner because first of all, you just want to survive and you want your family to be okay and you want them to be safe. But mental health comes really, really at the end. It's really not a priority, although people experience the issues with mental health, the high levels of anxiety. With COVID, we've been seeing a lot more difficulties too, because families need to work. If they don't work, they just cannot afford to not work, so in many of their jobs, they're in jobs where they don't have that job security that many of us do have. So that's another component as well. But even when we were having the issues last year with the fires, many of my clients who live in many of the apartments, they were saying, well, they were warning us that we were going to be having to evacuate, but they said, where are we going to evacuate to? We have nowhere to go. and we're so many in a family, or sometimes the issue is this, that because of affordability, you have multiple families living in, just in one room at a time. So that definitely is something that is a challenge, I know, also in the Latinx community. So thank you.
Huge issues. Thank you so much. And Allison, do you want to, can you chime in on what you're seeing as some of the barriers?
Yeah, so at my organization, we help everyone navigate through the healthcare system. So whether that's Medicaid, CHIP, the Children's Health Insurance Program, or Obamacare, also known as Marketplace. And we work one-on-one with individuals and families, really making sure they understand the process and helping them with any of those barriers that they have with verifications. So, that could be they need a letter from their employer or 30 days worth of pay stubs. A lot of the populations that we work with, just don't know how to go about getting those materials. So we'll kind of act as that case advocate between the client and Department of Workforce Services, that is the state agency that determines Medicaid eligibility, and really make sure that those forms are getting in so that they can properly determine eligibility. And there's a few very distinctive barriers with helping people apply for Medicaid. And I think one of them is just the whole process. It's a big application. And if you're applying for food stamps as well as other programs, it's even a bigger application. And just all of the paperwork, they tell you to go online, but I think a lot of the population and people that we work with, either English is their second language or that they have a technology barrier. I mean, we work with the state prison, and a lot of these people, they could be getting out after 10 to 20 years, and technology has changed a lot in that time. So they're not gonna understand on how to go through that process. So I think a lot of what we see helping people is just depending on what community we're working with, there is a big question mark of, well, why are they asking for this information if this person in my household isn't applying for health insurance? So for example, a lot of our teams work with the Hispanic and Latinx population because we have the highest uninsured rate of Hispanic children in the nation. I mean, it is incredibly bad, and there's a lot of things that fuel that, but I think a lot of it is fear of the public charge of, if you have undocumented parents and maybe the child is a citizen, there's fear that if I put this information on there that they are going to be deported. And that has been a huge chilling effect with having children stay on health insurance and to access resources that are available to them. So I think there's in different communities, there's different barriers. And I think when we work with them and when we work with clients, it's really asking them what they see. And, you can give them the education and the tools, but ultimately, they can decide whether or not to apply. And I think there's a lot that, with children specifically, there's so much preventative care that if they have access to a stable primary care provider and to mental health, then some of those needs that could be further later on that could be have issues, they could be addressed then. So I think, but there's so much mistrust and lack of access in those communities. So I think, that's just a small pocket of what we've seen.
And we're gonna come back to talk about outreach and case management, which I think are so important. But first, I want to talk a little bit about stigma. And our goal at Connect is to reduce stigma. And there are really two kinds of stigma. There's the stigma that we self-internalize, the shame we have if we have an issue. And then there's community stigma that makes it very hard to get help. And I want to start with Sister Veronica on this topic, specifically with the population you're working with. I think we've just discussed so many barriers, but stigma is one of them also. And how do you address that in the population you work with?
So I definitely agree. It's definitely an issue in the Latinx community that I work with, a lot of people don't even want to start coming to receive mental health services because they come with the idea, oh, I'm not crazy. I don't need to be doing this. All I came to the clinic was just to tell them that I was having palpitations. And so they don't know that those are signs or symptoms of anxiety. So they're like, I don't even know what I'm doing here. So a lot of times it's what I get when they come to see me. Other times it has to do too just with the language of what mental health is, and even in Spanish, for them to be able to understand it's okay for you to come to therapy. This is an opportunity for you to be able to get well, and so that your health is going to be better if you're feeling better, and your family is going to be better if you're doing better as well. But definitely, and I'm also seeing a lot more clients coming into the community that are coming from other countries, where many times agencies that were run by the government were definitely not to be trustworthy. So sometimes even with the confidentiality, we have to keep affirming them. Whatever you share with me, unless it's these areas of suicide or wanting to harm someone else or abuse towards adults who have disabilities or children, what you share is confidential, and the level of trust. So you have to build that trust, and that takes a lot of time for them to know this is a safe place. No, you're not going to call immigration to come and get me because I'm telling you about the stuff in my life. And so, so just building that piece about trust and helping them to be able to know, this is something for you. It's something that can be helpful to you. And some of them are funny because they'll say too, like, my family is making fun of me because I'm coming to therapy. But I come here and then I feel better when I go back. So I said, okay, so that's good evidence that this is working. And so, so those are some of the things that, many of my clients have shared with me. But I saw in one of the questions that, do people in Summit County realize, I think, the homelessness and the issues that we have? I don't think that we sometimes do. I think a lot of times we like living in Summit, we like living in Park City, and we think, oh, the world is so great with the mountains, everything is so beautiful, but we forget to look at other issues that are really right in front of us as well. So thanks.
Thank you. Really interesting, this whole idea with the last topic about folks traveling up here and what a stress that is. Then you add childcare, so many things that we need to address. Jackie, I want to move to you because I think that you also have a unique view on this, having grown up here, and you have that you're doing amazing things. You've a great advocate, but then experiences with stigma, being a young person that might have been struggling in Park City. And what can you educate us about that? How can we do better?
Yeah, absolutely. It's definitely something that was a big factor in the way that certain events played out. Growing up here and struggling with mental health concerns. Relating to stigma, I think for me, it was kind of a compounding issue of both of those definitions of stigma, both that public external shame that someone might be feeling, as well as an internal component. And I think a big piece of this for me was that mental health wasn't really, at least that I can remember, talked about or discussed, like in my house or in our school system. And I didn't really know or understand that there was help and what that would even look like, or where to go to access that, or that these things were feelings and experiences that people who were not me also have sometimes. I felt like I was the only person in the world who had ever been having these experiences. And so what help could there possibly be, and where would I go to find it? I just don't feel like I knew at the time. And I think that comes from a public stigma of not wanting to have these conversations, and particularly maybe not wanting to have them with children and youth. I think a lot of times there's an idea that if we talk about things with kids, that it like puts it into their head. And that's just not a healthy way to address these types of issues. And And then the other piece of it for me was, growing up here in Summit County and Park City specifically, I had all my basic needs met. I have a house that I live in. I have a family. I have food every day. All my basic needs are met. I could not ask for a more wonderful, set of circumstances to be born into. So why am I feeling this way? Why are these thoughts in my head? There's no reason for that. So that personal stigma for me was also a big barrier to kind of seeking out help. And I think even in the last few years, over the years of growing up here and, witnessing how things change, I think a lot of this is starting to be addressed, like talking about it more with our youth, giving them ideas of what kind of help is out there and what help exists. So I think that's promising and I'm happy for it.
I love how it's come full circle and you're helping others now and, a real advocate. And that kind of leads me to asking a question to you, Nelson, just about the school and some of the school-based programs, which we understand have not been, running as normal because of COVID. Like what are some of the ways that the school and some of these programs are addressing stigma and, working, I know that you're with early childhood education and intervention. What are some things that you're doing or that you could see we could do to help with stigma?
Well, I think right now we're trying to do a lot of outreach to parents and to the students that are struggling. And I think that that's kind of the first level of intervention that we have. I would like to see us as a community do more broad reaching outreach where we do more social and emotional learning and growth that's focused on the classroom and not just those that are identified as struggling. Yes. I kind of think about our services as a funnel, and at the top of the funnel it casts a wide net, and we give some social and emotional learning and growth, instruction in the classroom. That could be small groups where we talk about, what do you do when you see one of your friends suffering from depression or anxiety, and give it a name. It could be, what do you do when you're going through that? Who are some of the trusted adults that you would talk to if you're having some of these thoughts or feelings that are hard for you? Just giving kind of everybody basic tools. I'd like to see us do more of that, frankly. Yeah. And then the place that I'm most able to intervene is maybe 7 to 12 kids a week at a school where we can do individual counseling. And then starting next year, we're going to have probably 1 to 2 students a week get psychiatric evaluations from the University of Utah that will get reports that go back to the primary care provider and to the IEP teams at the school and to the parents that talk about ways to work with them. So it's that's a very specific kind of costly intervention for people that really need the help. But I'd like to see it be something that works with everybody at some level, but then you kind of tailor the need depending on what they need. Yeah. And, the stigma really can be, I think that would be destigmatizing, because then everybody gets some instruction and everybody can talk about it. Stigma really thrives in the dark. And Jackie said very eloquently, one of the things that I was thinking about the most, which is that stigma comes for everyone at the end of the day. We all are victims of our own expectations and society's expectations that we don't live up to. And for some of us, that's harder than for others, but everybody has had that experience where they think they're the only one who's gone through something, or they're the only one who's messed it up. And I think it's really powerful to let people know that you're not alone in that. So I'd like to see us do a better job, frankly, of reaching out to everyone and giving everyone some basic mental health tools.
Comprehensively, like through, going into classrooms and, we have some things going on in the schools right now that we should mention. There's been some scary stuff that happened. It's now in the media. And I feel like it needs a community and a school response, because it really does affect all these things we are talking about: stigma, mental health, vulnerable populations, and it needs a community response.
What is more important than to teach kids how to work well with others and to treat themselves and others kindly?
Yeah.
I would struggle to think of something better to teach them in school and in the home.
Absolutely. Well, thank you. Anybody else want to chime in on this? And anybody from the audience have a question?
You know, I'm happy to chime in.
Yeah.
I just enjoyed listening to the conversation. I think it's been just really wonderful. I will, just to follow up on a couple of points that were made. I'm the daughter of immigrants, and so it's very interesting in different cultures. They don't necessarily have the same language that we do around mental health and what it means and why it's something we should attend to. And so I think going back to that point, that we need a workforce that really does look like the people they serve. And that right there will help to break down some of those barriers and help people to feel safe and engaging in mental health treatment. I think that's really important. And also, as I think about, you know, I've been in the mental health world for a number of years now, and we used to talk about if we could just get one celebrity who would speak openly about their mental health issues, that would change everything. Well, here we are, and we've had several, and it's had a huge impact. But clearly, there is still stigma. And I think that's true. We all have stigma. I think we all have things that we need to work through and process ourselves. And I think we need to be careful too that a couple of things, we don't pathologize what is a normal response to stress or hardship or grief, or that, you know, that's part of the human experience. But for people who do struggle and can't get past that on their own, that they get assistance and help for that. But also, I think there is still the stigma for people with really serious mental illness. So now maybe it's more acceptable for a certain group, certain of us, to have mental illness and to be open about that and talk about it, and we can have frank conversations. But there still is this stigma and this othering of a population that's very vulnerable. And that's where I think we all could have some work in these areas.
Very well stated.